We're here with Dr. Kathleen Ragsdale, who is professor of medical anthropology at Mississippi State University. And it's really great to have you with us.
Thank you. Glad to be here.
You're probably the only medical anthropologist we have in Mississippi right now,
Well,
right?
I don't know.
Yeah. As a medical anthropologist, what is your, I know you're a social scientist, what do you do as a medical anthropologist?
So as a medical anthropologist, I'm really interested in how health is affected by culture, so why people do what they do. And a lot of times, even though people know that something might not be the best behavior for them and it will have some health consequences, they still engage in that behavior. So I'm really interested in how culture is affecting people's health.
Right. And culture is so much of what we are in Mississippi,
Right.
so much of a positive about what we
Right.
are, and so much involved in some of the negative things that we're trying to address
Absolutely.
at Southern Remedy. So that's perfect, and we really appreciate you taking time to be with us. Now, you do a lot of your work in Africa. I know you have a lot of activities here in Mississippi as well,
Right.
but where in Africa have you been working?
So right now we're working in Ghana and Mozambique, and we're on a USAID project that's looking at trying to increase soy crops with women farmers, because they're the majority of the farmers in Africa. So trying to help them have cash crops so that they can actually take better care of their families.
So this is an area where immunizations, which is a topic of what we're talking about tonight, are not always available.
Right.
And in many of the better off areas of Africa, we have social situations that are not a lot different than we have here in Mississippi, except vaccines aren't available.
Right.
And then you've worked in the Delta and other places in Mississippi, so you really understand this issue well. Why do you think people in Mississippi are having so much trouble thinking about vaccines, and why so many people are fearful of vaccines?
You know, I think this is not a Mississippi issue. I think this is an issue all across the United States, and I think it's really interesting when you think about this in terms of the historical context. People have always been worried about vaccinations ever since the late 1700s, when the science of vaccines really started coming about. People have been very, very concerned. People have said that people should not be vaccinated on terms of religious grounds. And then today we even have countries like Nigeria, Afghanistan, and Pakistan, where again people are saying, you know, on religious grounds they shouldn't have vaccines, like they shouldn't have the polio vaccine. So it's really interesting when you take that long view of what's going on, because people have constantly been worried about this issue about vaccines. Are they safe? Are they effective? What are they going to do to my children long term? So then nowadays also I think we're up against the issue of the internet. So because there's so much information out there, it's so accessible, so people are bombarded with a whole lot of different kind of venues of information, and they don't know what's accurate. So do they go to Wikipedia? Do they go to WebMD? Do they go to Jenny McCarthy's site and look at, you know, how she's saying that autism is caused by the MMRs? So there's a whole lot of things that people are just trying to sift through. And I think also the climate in the United States right now is that there's a lot of mistrust of government. So people do not want the government telling them what to do, and especially when it comes to their children. So I think there's a lot of issues going on there.
So one of the things that I'm most concerned about is that people are actually questioning the opinion of their physicians.
Right.
Now, I know there are outliers, and certainly we've had some physicians who've misbehaved, and there are ways that they've been dealt with.
Right.
But that is especially difficult for a physician to understand. They question not only the government,
Right.
but also their physician, who is supposed to have been trained to understand these issues. Where is that coming from?
Well, I think the issue with that is that pediatricians, nurse practitioners, nurses, they're really on the front line, and they're dealing day to day with the patients, and who are the children, and then with their parents. And parents are concerned, they're worried about this stuff. So they're getting this information on the internet through YouTube and other venues that says that, you know, people, children are being over-vaccinated, that the vaccines aren't safe, that the vaccines are linked to autism. So they're getting all this information. And then sometimes pediatricians, nurse practitioners, nurses can be a little autocratic. and really demanding that the parents do it their way, and that then sets up this kind of a confrontation that is not going to be resolved very easily. So, when parents want to opt out, it's up to healthcare providers to figure out a way to gently help them decide to opt in. So.
Now, it seems that there's a demographic about the folks who have the biggest problem with this.
Right.
At least from our research, it suggests that they're well-educated, predominantly white,
Right.
Young people. Many of them are in the homeschool movement.
Right.
What is that about?
Yeah, I think that ties back into these issues of not having the government tell you what to do. So people who are opting out in other ways of like the education system are also wanting to opt out of things like, mandatory vaccines. So in a lot of states across the United States, people can have, it's almost like a conscientious objector. They can say, I don't want this vaccine for my child, and that's enough to let the school say, okay, you don't have to have your child vaccinated. But then when we get to these issues around herd immunity, and when not enough children are being vaccinated, then that's putting the most fragile children at risk, and also fragile older adults and things like that.
So explain this issue of herd immunity a little bit further. What is the point there?
So that is when enough people, what do we call it, like the ratio of people in the population that are being immunized are actually, because so many people are being immunized, it creates kind of a brick wall that is protecting the whole community from whether it's polio or measles or mumps or smallpox or things like that, or pertussis, whooping cough, which is actually very common and often has recurrences. And it's also interesting that measles is one of the issues that keeps coming up over and over because people are not getting their children vaccinated for that nowadays. And then there are outbreaks all the time in the United States. I mean, I think San Diego's had outbreaks. Other states have had big outbreaks.
And
we've
had a significant number of whooping cough patients outbreaks here in our own state, and episodic other outbreaks. So, what is your opinion about how we should go forward with this vaccine? Do you think people ought to be able to opt out? Should people, what can we, what is the best advice from somebody who has seen what happens in Africa when it's not available, somebody who's seen what we have here, which is a pretty good immunization rate, a very good one. We worked very hard to get there. And then we have folks who really just don't want to participate.
Right. I think one of the big issues is, I think that where the healthcare system, the medical system is kind of falling down, is that they're not keeping up with what's going on in the internet. And so many people are getting their information from the internet now. So if we're not seizing that opportunity the same way that fearmongers might be seizing that, or some people who are, very well-intentioned but maybe misguided in their information, are seizing those opportunities. I think the medical system has to do a better job of that, and it's interesting with the Centers for Disease Control. They did a really good outreach in 2009 with the H1N1 virus, and that was actually one of the first times that they became really involved in using Twitter, Facebook, and YouTube to get the information out there to people that vaccination is important, and how to also to reduce your risk. So I think we've got an opportunity there for that.
So usually in academic speak, an opportunity means that we probably aren't doing as good a job as health providers as we should to explain the information and give people more accurate information about what's going on. Is that what you're saying?
And I think it's so important, because I think we have to realize as, so I'm a medical anthropologist, and I consider myself a public health person. And so I feel like I'm in that camp, definitely in that camp. And I think that what we have to do is do a better job of getting the information out there, and also making it fun and entertaining or interesting or whatever it has to be, so that people will actually watch it, because we're competing for people's attention. And if we don't do a better job with that, then the other people who are putting their perhaps misguided agendas forward will have the day.
Well, let me give you a scenario that I've experienced, and that is a mom who I have a tremendous amount of respect for, relationships with, care of children, who has very, very hard-held views on immunizations. And I go through all this scenario that you mentioned, all the data and so forth and so on. And I get to the end of this, and she says, "Doctor, I respect what you have. This is my right.
Right.
And it's a matter of choice for me. It isn't a matter of all that stuff you're talking about, a lot of which I don't understand. It's a matter of what I see as best for my child, and I feel like my child shouldn't be immunized." How do we communicate with folks who come from an issue, it's more of a political issue, addressing a medical issue that I as a provider are trying to communicate on? I'm sort of lost as a provider in dealing with that.
It's interesting to think about what's happened, especially in terms of vaccinations, because when my mother was a child, she is one of the last generation of children who were affected by polio. And her mother would not allow her to swim in the summer because she was so concerned that she would get polio. And polio is something that we never see anymore. We don't even think about. So what has happened is, I have heard this a couple of times, and I thought this is it's a really interesting way to put it, that vaccine programs are almost a victim of their own success, because parents now don't worry about things that their kids are getting vaccinated for, because now they've become really, really more concerned with the vaccination as a risk, not getting the disease as a risk. So basically we've had a sea change in our culture around that. So now parents are really concerned about whether the vaccines are safe. And especially in the 1980s, they actually did a lot of improvements in vaccinations to make them much safer. But that there's always kind of a catch-up period, and parents are still not quite convinced that these vaccines are safe, and the issues around getting mumps, measles, smallpox, whooping cough are so distant or so distal to them that's not something that they're thinking about anymore. So,
has the public lost confidence in the medical community?
I don't think so. I think that the medical establishment just has to do a better job of getting the word out. I think we have to make sure that we are grabbing people's attention just the way that Fox News and are all the latest, was it the Desiree Jennings, was that her name? The cheerleader, was it Redskins cheerleader? All of a sudden this, I think they said that YouTube video got like 2.5 million hits. And so this is an issue where she said that she'd gotten the flu vaccine and had an adverse reaction. So what are we in the medical establishment and public health, what are we doing to counteract those kinds of things, and how are we, addressing those issues? Because they are really big issues. I mean, when you have 2.5 million people looking at a YouTube video, and a woman is saying that the flu vaccine caused a very, very adverse reaction, we've got to do something about that. We've got to kind of react in some way.
One of the things I've been concerned about is, in America, one of the things we tend to do when we have someone we disagree with is to demonize them.
Right.
And it's very easy for the power establishment, the power component of the medical establishment, to say these people are poorly informed, they are bad people making bad recommendations. But they are not poorly informed. Many of these people are well informed.
Exactly.
And so the response to that is they're selfish. They're more concerned about their child's risk than the risk of the larger community, who is put at risk if their child is not immunized. I know that's a really torturous way to describe it, but I'm hearing this. How do you address that?
I think that's exactly right. I think you have hit the nail on the head. That is the big issue. Like, how do we balance people's individual rights to protect their child, to be concerned about their child's health, with the greater good, with what is good for the community and society at large? And there's no easy answer to that. I think the best solution is to really try to help parents be better educated, and then they will have to make their own decisions.